There are 38.4 million people living with HIV globally. With South Africa home to the lion's share of this, AIDS scientists, policymakers, NGOs and government are regrouping post-COVID-19. Among them is Dr. Farid Abdullah from the Medical Research Council. Concerningly, during the global COVID-19 pandemic, the number of people who tested for HIV in South Africa decreased by 20%.
All the people who didn't have their treatment are now arriving at the hospitals in a much sicker state. All those people who never tested are now presenting with severe disease, whereas they would have presented with mild disease. So we have this HIV rebound phenomenon, and we actually need more money in the health services to accommodate this new need. So the rate of new patients starting anti-retroviral treatment stagnated, declined compared to previous years. And for the first time in the last 15 years, globally, there's been an increase in mortality from HIV.
Young women remain the most vulnerable to the disease, making up a third of all new infections. Research and the development of preventative interventions specifically here is a key priority. The Dapivirine vaginal ring is easily insertable and replaceable after 28 days. The second game changer has been oral pre-exposure prophylaxis or PrEP. In South Africa, this once-a-day pill is freely available at all healthcare centers. But are these preventative measures reaching enough young women fast enough?
And I would consider that to be a failure on our part, because if you look at places like London or Paris or Berlin, it's the oral pre-exposure prophylaxis which has really completely snuffed out the new infections there. They've brought their epidemics under control, and we have injectable PrEP, which we should be deploying on a much larger scale. It's quite it's quite concerning that the price of the injectable is so high that it's unaffordable to use in a country like South Africa, and we should be campaigning quite hard to bring the prices down.
Abdullah is appealing for resolve by pharmaceutical companies and government to substantially decrease the price of injectable PrEP. While approved for use in South Africa, it is currently overpriced.
We need to make a big stink about the price of injectable PrEP. And we need to get government involved to force the pharmaceutical companies to bring the prices down. We need urgency to get generic companies to start producing it. We need government to start making commitments that it will, buy sufficient quantities of injectable PrEP if the price comes down.
The struggles of civil society will no doubt be heard loudly this week. These frontline HIV warriors are struggling with funding, most notably the Treatment Action Campaign.
It's going through a difficult period now. It had to retrench a whole lot of staff because it didn't have the funding. But these are the people who brought us to where we are. If it was not for the Treatment Action Campaign, over the last 20 years, who made sure that 5 million people have treatment, and to have a situation now where the Treatment Action Campaign is underfunded, is struggling, is something that as a HIV community we need to step in.
Civil society voices will lead the charge with a march on Tuesday morning ahead of the official opening to the 11th SA/AIDS conference in the afternoon. Minoshni Pillay, SABC News, Durban.